There are 11 indications and symptoms of vitamin B6 deficiency. Vitamin B6, commonly known as pyridoxine, is one of 8 vitamins in the B-complex group. Most individuals receive adequate B6, but if you are low in other B-complex vitamins like folate and B12, you are more likely to be poor in B6 as well. Vitamin B6 deficiency is more frequent in people with liver, renal, digestive, or immunological disorders, as well as smokers, obese people, drinkers, and pregnant women. B6 participates in about 150 enzymatic activities in your body. These aid your body's digestion of protein, carbohydrates, and fat. Vitamin B6 is also associated with neurological and immune system functioning. B6 has recently been discovered to have antioxidant and anti-inflammatory effects. This suggests it might have a role in preventing chronic diseases, including heart disease and cancer. In this video, we discuss typical symptoms of vitamin B6 insufficiency. So watch to the end to learn about the 11 indications and symptoms of vitamin B6 deficiency. Number 1. Rashes on skin. If your skin is itching and the red rashes continue, you may be suffering from a vitamin B6 deficiency. Seborrheic dermatitis is the medical term for these rashes. These rashes might appear on your scalp, neck, upper chest, or face. The rashes may enlarge and develop white spots on them. The greasy and flaky look of your rashes on your skin might also be a clue. When collagen is synthesized, vitamin B6 plays a vital part, and as a consequence, you have healthy skin. However, if you are deficient in vitamin B6, you may experience skin issues. So, if you have skin rashes, you should boost your intake of vitamin B6 right away to receive relief. Number 2. High blood pressure. This is a serious symptom that can lead to a heart attack. Prolonged vitamin B6 deficiency results in excessive blood pressure, which must be addressed quickly. It may also result in the patient's death if correct medicines and a healthy diet are not followed. Number 3. Cracked and sore lips. B6 deficiency can cause cheilosis, which is characterized by painful, red, and swollen lips with split mouth corners. Cracked skin can bleed and get infected, as well as be extremely painful. Eating and talking might be tough when your lips are cracked and painful. Correcting B6 insufficiency with vitamin-rich meals or a pill may alleviate these symptoms. Notably, riboflavin, folate, iron, and other nutritional deficits can also induce this disease. Number 4. Weak immunity system. To avoid illnesses and viral assaults, you must have a robust immune system. The vitamins and minerals contribute to the immune system's strength. Vitamin B6 is one of the most important vitamins for strengthening your immune system by creating an adequate amount of antibodies in your body. Along with T cells, it generates white blood cells. These cells are linked to the immune system's strength. It's important to remember that a lack of vitamins and a weakened immune system can lead to life-threatening illnesses like cancer. Number 5. Sore glossy tongue. If you are deficient in vitamin B6, your tongue may become swollen, painful, inflamed, or reddish. This is known as glossitis. The disappearance of papillae, which are the bumps on your tongue, causes the glossy, smooth surface of your tongue. Glossitis can cause problems chewing, swallowing, and talking. Replenishing B6 is used to treat glossitis when a deficiency is the only reason. Other nutritional deficiencies, such as folate and B12, can also contribute to this disease. To clear up glossitis, you may need to consume enough of all of these vitamins. Number 6. Mood changes. B6 deficiency can impact your mood, contributing to melancholy, anxiety, irritability, and heightened sensations of discomfort. This is due to the fact that B6 is involved in the production of numerous neurotransmitters, including serotonin and gamma-aminobutyric acid. Both serotonin and GABA aid in the management of anxiety, sadness, and pain. The effect of B6 in addressing such mood problems has been studied in a number of settings. For example, supplementing with B6 helps reduce behavioral difficulties in around half of people with autism, probably because it aids in the production of neurotransmitters. Taking 50 to 80 mg of B6 pills daily may also assist with premenstrual syndrome symptoms such as moodiness, irritability, and aggressiveness, according to research. Anxiety and sadness are both common. Number 7. Pain and tingling in feet and hands. Inadequate vitamin B6 levels can cause nervous system damage, resulting in discomfort and a burning feeling in your hands or feet. This tingling sensation in the feet and hands is a common symptom of vitamin B6 insufficiency. When you have this sort of difficulty, you should begin to consume more vitamin B6-rich meals on a daily basis. taking an excessive quantity of pyridoxine HCl, generally known as the inactive form of vitamin B6, can also cause neuropathy. This intake has the potential to inhibit the active PLP form of B6. If you have a B6 deficiency, you can recover quickly by changing your diet. However, B6 toxicity is difficult to manage, so you must be cautious of how much you consume. Number 8. Seizures. Seizures can occur for a variety of causes, including vitamin B6 deficiency. Your brain may get overstimulated if you don't have enough B6. Seizures can produce muscular spasms, rolling eyes, and jerking arms and legs. People may have fast, uncontrollable shaking convulsions or lose consciousness at times. Seizures in neonates are widely recognized to be caused by a B6 deficiency. The first examples were discovered in the 1950s, when newborns were fed baby formula that lacked B6. Seizures caused by vitamin B6 deficiency have recently been observed in adults. Pregnancy, drinking, drug interactions, and liver disease were the most prevalent causes of these instances. Correcting B6 deficiency has proved to be quite effective in treating associated seizures. Number 9. Tiredness and low energy. A lack of vitamin B6 might cause you to feel particularly fatigued and sluggish. One important explanation is that vitamin B6 aids in the production of hemoglobin. This is the protein found in red blood cells that aids in the transport of oxygen throughout the body. Anemia occurs when your cells do not receive enough oxygen as a result of a lack of hemoglobin and can cause fatigue and weakness. However, in a few cases of B6-related anemia, the inactive pyridoxine hydrochloride version of the vitamin did not assist. However, supplementing with pyridoxal 5-phosphate, the body's most active form of B6, cured the anemia. Number 10. High homocysteine. Homocysteine is a result of protein breakdown. Because these B vitamins are required to help metabolize homocysteine, a lack of B6 or folate in B12 might result in an unusually high blood level of homocysteine. Homocysteine levels have been related to a variety of health problems, most notably heart disease, stroke, and Alzheimer's disease. When homocysteine levels are high, it can cause damage to blood vessels and neurons. Number 11. Poor brain function. A lack of vitamin B6 is to blame for impaired brain function. You should keep in mind that the brain plays an essential role in connecting with the rest of the body, so you should provide it with enough nutrients and vitamins to keep it functioning. Brain difficulties can be caused by a lack of vitamin B6. These symptoms should serve as a warning for you to check your daily consumption. To keep fit and well, you need to consume at least 40 to 50 grams of vitamin B6 on a daily basis. If you enjoyed this video, hit the like button and share it with your friends. Also, please subscribe to Health Dome for more videos like this. I can't grow this channel without your support. Thank you for watching. Stay healthy. Bye for now.